Hello, everyone. I'm Ken Cook with EWG, and I hope you're safe and healthy and taking very good care during these extraordinarily challenging times. I'm here today to talk about an incredibly important topic, the novel coronavirus, I should say, the pandemic disease it has caused, COVID-19. So it's COVID-19 and kids today, and we're going to explore what we know about that, what the risks are, how can we protect kids, how are parents and caregivers coping. And I want to start by telling everyone we're not here to give you medical advice, even though we have a doctor who's going to join us right now. I'm here to say always consult your doctor on health and medical matters. And in the case of COVID-19, make sure you abide by the guidelines of the CDC, the Federal Centers for Disease Prevention and Control. We'll have a link to that in the video. And please follow the social distancing rules that have been put in place by local and state authorities. And if they have not been put in place, then follow the guidelines that have been put in place by states that are paying attention, because we don't have uniform coverage with respect to guidance there. I'm here today with, we could not have a better person to talk to about this topic of COVID-19 and kids, legendary pediatrician and my dear friend, Dr. Harvey Karp. Harvey, you've had thousands of children in your care over your career. Your book, Happiest Baby on the Block, among other things, introduced the concept of calming infants through swaddling, and that has made it a staple of infant care and a vital mental health tool for parents. And you've taken all of that the next step with the invention of SNU, the remarkable bassinet you invented, and your company behind it now. More about that later, but that is also really relevant to this time when we need to be taking care of parents as well as kids. So you're on our board. You've been on our board at EWG for a long time, along with your wife, businesswoman extraordinary, Nina Monte Karp. Thanks for joining. You've been at the forefront of protecting kids from environmental harm for decades. You're really a pioneer. I've learned so much from you. And here we have an environmental crisis that is extraordinary, and the only measures we have to deal with it so far, no vaccines yet, no treatment drugs that we know of that really work. We're dealing with it through environmental measures. So it's quite a learning moment. So Harvey, welcome, and put on your environmentalist hat for a moment. What do you make of this crisis from an environmental standpoint?
Well, good to be with you, Ken, my good friend, and so appreciative of getting to work with EWG for these past 6 or 7 years, and the incredible work that everyone in the organization does. So let me just start out with that as my preface. You know, what are the parallels between the environmental movement and COVID? You know, I'm reminded that it was 40 some odd years ago that I was on a picket line for the first Earth Day at the University of Buffalo, where I was a student at the time. And we made a lot of progress, actually. We cleaned up air, we reduced air pollution, we stopped the Cuyahoga River from being on fire, and instituted safe waters legislation, among others. But the parallel that I see, which is very disconcerting, is that this is all obvious, right? I mean, it's obvious that there was going to be a pandemic. There's obvious that it's going to happen repeatedly. It's obvious that we have problems with the environment. It's obvious that they don't get better. It's obvious that people who make a lot of money sometimes are conflicted because the profit is contrary to what is right to do for the community and the culture at large. And so this is one of these crazy situations where just the other day, our president cut the payments to the World Health Organization. We give about $500 million a year to World Health Organization. At the very same time, he approved a $25 billion bailout for the airline industry. And I'm not saying that airline industry doesn't need help, but it shouldn't be at the cost of world health. This is the foolishness of our looking at our noses and not being able to look at the world in front of us. And I think that's the same exact issue with environment writ large, whether it's global warming or pollution of our waters or unsafe products coming into our homes. It's all just be smart, common sense. Obviously, don't pee in the bed where you sleep. Don't contaminate your own world. And ultimately, as a pediatrician and a counselor of parents, the hardest thing is that parents are preparing the world for their children and their grandchildren. And suddenly, after being so busy in your adult world, you suddenly step back and you see a perspective of a world that's larger than you. And parents are very frightened now about what is going to happen to the world that we're leaving our children.
Yeah, no question about that. And while we're on the topic, even though this is about COVID and kids, let's start with the parents. That's who's going to be listening to this for the most part. How do they take care of themselves? What do they need to be mindful of? I think of the advice you get, the instructions you get on an airplane. Put your oxygen mask on first, and then help your child. What should we be doing right now as parents to be thinking about the extra steps we need to protect our kids? We have to stay healthy, or we can't care for them.
You mean specifically about COVID-19?
Yeah, about COVID-19. Yeah.
Well, listen, you're a dad of a young boy, and you're living this every single day. So your comparison to putting on your oxygen mask first is apt, right? Because we should be putting on masks. And when we go out, we want to protect ourselves from inhaling droplets. We want to protect others from our expelling droplets if we happen to be getting sick. But many things that you can do to help keep yourself safe. Number one, take very seriously the social distancing recommendations. Be neurotic about hand washing, about cleaning your doorknobs, about cleaning packages that you bring into your house. The reason why you want to be neurotic, it's that old risk-benefit ratio. All right, so you feel like an idiot that you're washing everything down with alcohol, and maybe you're overdoing it. But as Tony Fauci, who's leading the medical response to this terrible disease, says that with an epidemic, you always have to seem like you're overreacting, because while you seem like you're overreacting now, in 2 weeks, you're going to seem like you underreacted. You have to get ahead of it. And so be extra careful. Go outside, get fresh air, just keep your distance from people. And it's at least 6 feet. It's not like 6 feet is the magic number.
Right.
It's at least that amount. And eat well, get rest. Probably the most important vitamin for your immune system is sleep. It helps your white blood cell function. It helps your reduces inflammatory reactions. So that's something that everyone can try to pay attention to. When it's getting late at night, turn down the lights so it gets a little dark, a little kind of orange colored in your house, because that signals the brain when you're getting ready to go to sleep. Having bright lights and looking at screens is something that stimulates the brain and can make it hard to fall asleep. And God knows people have a hard time falling asleep now because of all the stresses and the
exactly
so many people have. And then one other thing you can do that there's some good medical evidence for is taking vitamin D, getting some sun exposure and taking a vitamin D supplement. Of course, eating well in general. It's hard not to eat a lot of junk food, when you're under stress, but trying to eat a good plant-based diet, lots of vegetables, maybe a little junk food along with that too, but at least you've had your vegetables, so that you're modeling properly to your children. And also what you eat does affect your mental health. And then you can supplement that with a little extra vitamin D.
Yeah. Well, we want parents to stay healthy. Some of the data that have come out so far, a little bit encouraging, but it's also incredibly early to be reaching too many conclusions. But some of the data coming out suggests that infants and children have not succumbed in the numbers that we might have feared. But part of that, I think, is because we've closed down the schools and pardon me while I stop the outside world from intruding. We've closed down the schools in most of the country. Kids aren't, by and large, traveling internationally. The social distancing has worked. But if there's one sort of slightly encouraging number that's coming out of some of the data that we've seen so far, most recently in April from the CDC, it's that infants and children do not seem to be differentially coming down with the disease and being hospitalized for it. So there's a bit of hope there, but all the more reason to keep it that way by social distancing.
Well, that's right. And the thing that's scary, so there are different viruses have different effects on children. Some of them are much more impactful on children and even on fetuses. So you have something like the Zika virus that can give you fever and make you feel terrible as an adult, but can literally destroy the brain of a developing child. Yeah. German measles is similar. Other viruses like what's called Epstein-Barr virus, or the virus for infectious mononucleosis. Adults can be laid up for months with chronic fatigue symptoms after they get sick with that. Even a teenager can, but a young child, often they don't even have symptoms. They get it and you wouldn't even know they were sick. So that's not uncommon that viruses affect different age groups differently. And so, yeah, we're very fortunate that it seems, at least, that fetuses rarely pick this up through the placenta, and that young children fight it off better. We're still worried about newborns because they don't fight infections well anyway. So we really want to protect them. But this kind of goes back to your first point, which is that the worst possible, not the worst possible thing, but a really distressing situation is when the parents get sick. Yeah. And who's going to take care of the kids? And especially now that you don't want people coming into your home, your friends can't come over, you can't drop your child off at someone's house for a week. You can, but it's more concerning. Your family may not be able to fly to your house and your mom come over for a week to help spell you. So if you get sick as the parents and you have to be hospitalized, man, that's a very tough situation. So again, this is why you want to overreact. You want to be extra cautious, extra careful, because the consequences are pretty dire. Yeah.
No, thank you. Deb and I, with our little boy, Cal, we've already gone through the scenarios. If one of us gets sick, how do we set up the guest bedroom? All the things that we'll have to try and do to care for him while preventing him from, coming down with a disease we may have contracted. So, yeah. Sure. So we have 80 questions come in for you, Harvey, from our audience. So let me just start on a few of those if I can. A lot of them focus on kids' mental health, how they're adapting and adjusting, and what parents can do to help them adapt and adjust to this social isolation, being home all the time with mom and dad. My 11-and-a-half-year-old is he has only so much patience for that. But what can you advise parents who may be worried about how their kids are coping mentally with this time?
All of this is a stress on all of us in the family, but it turns out that stress is not necessarily a bad thing, right? Stress is what prompts us to kind of act and to improve and to optimize and to, that old saying, whatever doesn't kill you makes you stronger. There's an opportunity here to respond to a tragic situation. And I'm not trying to be a Pollyanna or just put whipped cream on the issue. But I absolutely believe that this is an opportunity to build resilience. So a couple of things. Number one, when you are stressed, the thing that helps you the most is having people who love you, who can listen to you. And when I say listen, it doesn't mean that you're trying to pat them on top of the head and make them not feel scared if they're feeling scared or feeling angry that they can't see their friends or whatever their feelings are. The interesting thing about feelings is that when you express feelings, they make you healthier. When you're sad and you cry, you're able to get over your grief, especially if someone's there to hold you and care about you and listen to you. They don't have to solve it for you. They don't have to make it all better. They just have to be there. Same thing with anger. You can be angry with someone and express it. And if they can hear you and you can have an honest dialogue about that, you actually have a better relationship than when you started. And so, and on the flip side, if you have emotions that don't get expressed, that stay inside of you, it turns out emotions never really go away. They just build up and pile up inside, and then they affect the way we act in the next similar situation. And ultimately that undermines your ability to be intimate with someone and your own sense of self-worth. So all of this gets to something that's easy for parents to do, which is to acknowledge their child's feelings. If they're happy, if they're sad, if they're frightened, doesn't matter, if they're frustrated, always start by acknowledging feelings. But, and this is the really important but, when someone is upset, it's not the words you say, it's the way you say the words that make the difference. If someone's upset and I say, oh, that's very upsetting, I understand why you feel that way. I mean, that little sort of psychiatrist almost makes you want to smack me across the screen. It is not very satisfying, and it feels distancing, not reassuring. On the other hand, if someone went, oh my, yeah, I know. That's not very eloquent, but it feels more like someone is there with you. So so I wrote a book called Happiest Toddler on the Block, which talks about kids from about 8 months of age up to 79, 84 years of age. I mean, because we all become toddlers if we get upset enough. And so these are communication-based techniques that you use with young children who are pre-verbal or early verbal, or any of us, because we all become toddlers if we get upset enough. Acknowledge feelings, and then there's a technique called toddlerese, which is how do you translate it into the language of a toddler or anyone who's very upset. And there are 3 steps to doing that simple translation. The first is short phrases. Don't have long sentences, just 1, 2, 3 word phrases. The second is lots of repetition, 5, 6, 8, 10 times of repetition. And the third is having a third of the emotion that you reflect back to the person. You don't reflect all of their emotion. If they're screaming on the ground, you don't scream on the ground as well. You have to have about a third. This is a dance, an emotional dance, or it's also called serve and return, like a tennis match. So back and forth, you know, someone says what they're feeling, you say what's back. That's actually the normal way we speak with people, right? Good morning, how are you? Fine, blah, 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 back and forth. When someone gets upset, that normal rule of back and forth or turn taking changes. And it becomes what I call the fast food rule, which basically means the hungriest person gets to eat first. And so whoever is hungriest for attention gets to go first. Usually that's your toddler. Sometimes it's your spouse or you. And the key thing is when that person is upset, you acknowledge it in this 3-step way: short phrases, repetition, and mirroring a third of the emotion. I'll give you an example. So the child is upset, they want to go outside, but you're not letting them outside and they don't understand. They're screaming at the door, outside, outside, outside. You know, maybe it's a 2-year-old. And you're going to say, no, honey, it's raining. We can't go outside. Let's play inside, whatever your explanation is. And you'll get there, but don't start there. Start by gesturing, using your tone of voice, the look on your face and your gestures, just to go outside. You want to go. You say outside, daddy, outside now. That sounds idiotic when you just hear it out of context. But in fact, that's how we talk to people that we love who really have strong feeling. Yeah. If you're upset, I'd go, oh no, I'm so sorry. I am so sorry. I mean, I'm really sorry. I don't know what to say. I'm just really, really sorry for you. Very repetitious with a little bit of feeling. And actually, the cool thing about this technique is all parents do this automatically. We all do it automatically when our kids are very happy. When they're happy, we don't say, very good, sweetheart. Father is proud. We go, you did it. Wow, look at you. You tried so hard and you were climbing and climbing and oh, your face has got the biggest smile because you're proud of yourself. You really did it. Good job. Give me 5. That was really, really good. Listen to all that repetition and that emotion that's invested in it. That we do it quite normally. Feels a little bit like acting when we do it when kids are upset. But the more you practice it, the easier it gets. And this is the amazing thing. If you can give them that type of acknowledgement, then their emotions come down after a minute or two. Then you get to distraction or your explanations or that kind of thing. And children are much better able to hear that and to feel really respected and loved. And ultimately, then they grow up to expect that from others. Hey, listen, don't just belittle my feelings. I grew up in a family where people respected feelings and they knew how to acknowledge them. And that's what I want for my friends and the people I'm intimate with. So it turns out this is actually a really important foundational skill for all parents to have.
Yeah. And so during this time, what it sounds like your advice is, do it right the way you should have been doing it all along. And here's some tips for doing it. And it intensifies now because there are no social outlets beyond the home or the family. Any thoughts about how a parent can get through that? And, I've had a variation of that question from teachers who feel anxious, teachers asking, I can't be with my kids. I can't teach them. How should I feel about that? Or parents asking here in our questions, my child's not engaging with the teleclassroom, not interested in engaging with the screen. I mean, these are all really tough and pretty much unprecedented circumstances for all of these people and for all of us, for that matter, who have written in. Any thoughts on that?
Yeah, a ton of thoughts. And this kind of continues from the prior point. So that's just what you do, your way of listening when someone is immediately in stress. But there's lots and lots more things you can do for anxiety and boredom. Listen, it's an amazing thing. There's never been a time in the history of humanity when 2 parents were locked up into an apartment with a 1-year-old. I mean, it never happened. You always had the kids would run around, the 3-year-old would run after the chickens and the dogs, and you would have extended family or the village to help you. This literally has never happened before. So first of all, parents need to pat themselves on the back and recognize they're doing a phenomenal job, because it is not easy taking care of a little kid. And partly because we're boring to them, right? I mean, they need a dynamic environment. They do well in school because it's not just the teacher, but it's 20 other little kids parading around and playing things, and they're paying attention and they're nosy and they're so it's a very hard job to fill all of that void. And sometimes with school, it's just not interesting. It's boring, and any a self-respecting young child is going to say, this is a waste of my time. Put on Disney again. And that's the worst thing in the world either. This is the time when you don't want to be so hard on yourself, or what I like to say, don't shit on yourself, because you have these expectations of what a good parent does. Cut yourself some slack. If you're going to eat some treats, or you're going to watch a little bit more videos and things like that, or kind of screen time that you wouldn't ordinarily do, I wouldn't worry about that. But there's a lot of things that you can do. So one of the things is to help children learn balance. So of course, with adults, we can do meditation or mindfulness techniques. There are meditation techniques for kids. In the Happiest Toddler, we talk about magic breathing. So it's a way to teach even a 1- and a 2-year-old how to do kind of centering breathing. There are companies like Headspace and Calm that are apps that can help teach your child how to do mindfulness exercises. And then to the degree you can get outside, it's really more about art, reading, singing, and creating some interesting environments for children. And those environments might be in your backyard, if you have a backyard, where you're digging things up, you're looking for worms, your little mud pit, you plant seeds and you watch them grow, and you bring the child into the house then and they help you with cooking or organizing or measuring, and they get involved in something that's a little bit more interesting for them. That ties into another general concept for young children when you're stuck at home with them, which is that we can kind of have an amorphous day. It kind of comes and goes, the different things we want to do. But children do well with routine and with ritual. And so it's good to have a calendar, a schedule for the day. This is what time we wake up. This is what we do next. This is what we do next. And then hook little rituals onto that. And those rituals are what any good preschool teacher knows. Like before lunch, you have the song, we're now going to eat lunch, or the brushing teeth song, or the getting dressed song, or, you know, we do, you know, 3 sit-ups before we go outside, or we do 3 magic breaths before we go outside and play. And so there are certain kind of payments of organization that the child has to do so that they have a certain structure to their day and they have predictability to it. There's a technique I love called bedtime sweet talk, which is when you have your nighttime routine, whatever that is, and you read your books, the last thing you do is to tell a little bit about what happened that day and what successes your child had and what are the things you're looking forward to the next day. The reason these are so important is that routine, you know, they can't tell time. A 2-year-old doesn't have a good sense of the clock, but they have a very good sense of sequence, and routine and ritual helps them understand the chaos of the day. And that gives them a feeling of confidence and security. Same thing for a 5-year-old and a 9-year-old. The more you have predictability and routines, that makes them feel secure in an otherwise, you know, kind of crazy and scary world out there.
That's terrific advice. I'm going to put some of that into practice as soon as I get off this this visit. So here's a question, Harvey, that's, and I know you're going to say, consult your doctor, but I'll try. I want to give it to you anyway. This is someone writing saying, I live in New York City and I am 32 weeks pregnant. My husband and I are considering leaving New York right after the birth to stay at a family's home upstate. Do you think it's more important to stay in the home for a few weeks after the birth to establish a routine for a baby, or will it not disturb the process too much if we relocate 3 hours away?
Yeah, of course, as you said, you know, always consult with your medical practitioner to get their advice and opinion. You want to be in an environment where you feel at ease and you feel secure, and where you also have a lifeline. You know, what if you need medical help? What if something does happen? You need your doctor, or you need to speak to someone, or you need a support network. And maybe you have that, this family has that at this other home. But those are the things you want to think about ahead of time. The first 3 months of life are a challenging time to travel with a child because their immune system is weak. Having said that, the biggest risk to children in catching illness is contact with others. So if you're practicing good social distancing, you're dramatically reducing the risk that your child is going to get sick. Nevertheless, you just have to think ahead, you know, who am I going to call? How far am I away from help? What are the precautions I need to take? Do I need a first aid kit or anything to kind of have available in case something does come up in the middle of the night?
Yeah. Okay, here's another one. Is it okay to go for a walk with my 2-year-old granddaughter in the stroller without wearing a mask? I'm assuming it's the grandparent wanting the mask on, but all kinds of questions of that nature, right? Situational,
Sure.
what ifs, and this pandemic has raised all kinds of new ones. That, but how about that? How about going for a walk? Just going out. So a lot of questions like that. Should children wear face masks on longer bike rides? Is it okay to go outside barefoot? Do chewing, eating, or swallowing destroy the virus in food and drink? A lot of, you know, just people don't know. It's all new.
I know, it's really true. And none of us know for sure. I mean, even the doctors are really trying to research this as quickly as possible and get answers. We can make a couple of good guesses. So if you lived on a farm by yourself, you're a bachelor farmer and nobody's around for 20 miles, you don't have to worry about catching polio or whooping cough or measles or anything like that, because those are contagious diseases. You might have to worry about tetanus if you step on a rusty nail, because that's not a contagious disease. So influenza, things like that are things that you catch from other people. So it's the same thing with coronavirus, that if you're not around other people or you have adequate distance from other people, then you're protected. The very shocking truth of this epidemic is that if everybody stayed home for 3 weeks or 4 weeks, it would all be over. This is a fragile virus. The virus doesn't survive very long. It's kind of weak. It depends on us to be the accomplice, to spread it from place to place. And we're this unwitting, dumb accomplice that is doing the job for the virus. So, so for grandparents going out for a walk, number one, I would wear a mask just to demonstrate that to your neighbors, that you take all this seriously. I think that, of course, if you're sick, you should definitely wear a mask. If you're around anybody, really, these days, you should always assume it's COVID-19 and put up a barrier, wash hands a lot, etc. Barefoot is not a problem. We know that. It turns out colds are really spread by hand to face contact. It comes in through your eyes, through your nose, through your mouth, through mucous membranes, and then into your respiratory tract. So unless you're, we certainly don't have evidence that you get it from food that has been prepared by someone else, even if they're sick. I guess if they spit in the food or there's some kind of high dose exposure, certainly there's a possibility. But as far as we know right now, almost all the spread of this has been by very close contact or reasonably close contact. You're in a room with somebody for half an hour, you're having an intimate conversation. You maybe touch the same things they touch, and then you touch your eye. There seems to be some risk of spread by being in an environment where other people have been coughing, sneezing, and maybe breathing, and it's floating in the air a little bit, and that might stay in the air for hours, it seems. So even when you go to a grocery store, you want to wear a mask and protect yourself and protect others from you. I think that's kind of brings us up to the current knowledge. But coronavirus is a respiratory virus. SARS, MERS, and many of the common colds are related to coronavirus. So we kind of know what they do, right? We know how we spread that. There was an interesting study that was done many, many years ago where they had two groups of people. One was sick, one wasn't sick. And they had chicken wire down the middle of the room, but they were breathing the same air. And the illness rarely spread to the other side of the room. Then they repeated the experiment, but they cut a hole in the chicken wire and they put a card table in between, and people started playing cards, even though they were on the two sides of the room. And almost everyone got sick. So it underscores that idea about contact and transfer by touch and then touching your face. It seems to be by far and away the biggest risk that people are exposed to.
Well, that general advice does cover a lot of the questions that people have asked when they wrote in, but there are a few. One here is if you get COVID-19 and you survive and you're healthy again, how long does it take for you to be non-contagious? Do we know yet, or are we still learning about this virus in that regard?
Yeah, I think we're learning. There are different people have different answers to that. So some people are saying it's clearly several days after the fever goes away, after you're sick. I mean, I think that you're better off being conservative and waiting a couple of weeks after you've been sick, because God forbid, the last thing you would ever want to do is to share this with someone that you care about. And I know that I don't say that trivially or off the cuff. It's very hard to be isolated for a couple of weeks. Maybe it won't need to be a couple of weeks. We're learning about this every day. We're getting smarter about it. But I would I would tend to be on the cautious side about that right now, just to make sure, because definitely you can be over your symptoms and you can be contagious for some period of time. And as we know from any other illness, you can make general rules, but there are always outliers. And you may be the one who, even though the average is only to spread it for, 3 to 5 days after you're well, maybe you're the one who the virus lives in your nose for 10 days. I mean, you just want to be cautious. It's such a serious illness.
Yeah, no, it's really clear from the reports we get of people who come down with it. Some people are really hammered, and some people just carry the virus around and are asymptomatic but they're spreading it if they're in contact with others. But how about dogs? Someone wants to know, do dogs get the virus, and can dogs transmit the virus to humans?
Yeah, it's another area that we're learning about. There was one report of a tiger catching it from a zookeeper. By and large, we don't catch colds from dogs or influenza from dogs. But we do know that coronavirus can infect animals. And in fact, there are some suspicions that this virus originally came from an animal in China. So is it possible? Yeah, I guess it is possible. Is it common? It doesn't appear to be common.
Not the main thing to be on guard about. So this, a number of questions touching on really the societal dynamics of how we've learned about and how we're reacting to news about this disease. So the starting question might be, is the coronavirus killing more people than the flu, or is it overhyped as a threat? I guess if it's overhyped and it turns out not to be such a threat after all, people are feeling that too many aggressive steps have been taken with social distancing and economic impacts that flow from that and so forth. But my sense is that it's not been overhyped at all. But what's your take on this, Harvey? How do you explain that to folks?
Well, so what was how many Americans died in the Vietnam War? Is that like 57,000?
50,000.
Yeah, 50,000, something like that. So we've had 30,000 Americans who died in the last month with this virus. So that's why the president says it's like a war. Everyone is treating it like a war. This is not the flu. This is not influenza. This is an extremely serious thing that literally could kill hundreds of thousands, even 1 million Americans. The 30,000 is a terrible tragedy and an unnecessary tragedy, because we could have been much more aggressive and separating. Like I said, it is trivial in a certain sense. Just stay indoors for 3-4 weeks and we're all back to work, So this is not, it's all hyped up and it's baloney and people are, exaggerating the risk. And in fact, the more that we are namby-pamby about our response, and some people stay indoors and some people don't stay indoors, the more this is just going to be in our environment, and this is going to go on and hurting us and hurting our families and hurting our economy for a longer period of time. The old grandmother's line, just take the medicine, or it's a bitter pill, but take it. We've already seen the benefit of this type of an approach in China, in Italy, and we're seeing it more in Spain. It's the only way we know to stop the spread of this. Look at the meatpacking plant in South Dakota, hundreds of individuals who would think, well, we're in South Dakota, we're not in New York City. Well, surprise, colds are spread, influenza gets spread across the country. Why wouldn't you think, COVID-19 would be spread? So I think that most of this, this concern that it was overhyped is really propaganda from people who are trying to confuse us and mislead us into not believing about science and believing about our scientific leaders, our medical leaders. This is where science counts. This is, listen, if you have heart disease, you're going to go to the best scientist you can, the best doctor you can, who's using the best medicine, who's going to operate on you with the best techniques and the best technologies. It's kind of crazy how people are open to science on one hand, and on the other side, no, I don't believe. Yes, I know 99% of scientists say that the globe is warming and it's going to cause incredible tragedies. But you know, three scientists I read said that they don't know. And so you wouldn't do that with heart disease and the health of your family.
Right.
Why
Of
do
course.
that with this crazy stuff about the virus? It's obvious, you know, all the people who are hospitalized, the doctors who have died taking care of these patients. The spread of this is just absolutely frightening, and especially for but there are plenty of 20, 30-year-olds who have died of this, and it's a terrible death. It's a terrible, suffocating, drowning death. I mean, this is the most serious attack on our country since the Civil War. We damn well better take this seriously.
Yeah, yeah. So just a couple more, and then because I know you have to get to work, and so do I with other topics. But a lot of people asking questions having to do, Harvey, with sort of early signs or indications that either the social stress is beginning to get to them, or they want to know what are the sort of signs of onset of the disease itself. So one questioner says, my 8-year-old has developed an eye twitch. Could this be a response to stress? If so, how can we deal with this? My 9-year-old, another questioner writes, displaying a lack of interest in things and is aggressive and angry attitudes towards friends on social media sites. So you have everything from these behavioral manifestations to if you can talk us through some of the other symptoms of actually coming down with the disease as distinct from the social distancing. They're two important sets of basically physical, medical, psychological problems.
Yeah, so there's a broad spectrum of symptoms of the illness, right? From no symptoms at all to a runny nose and a cold to sneezing and coughing, a sore throat, headache. Been several reports that people lose the sense of smell and taste, which is related to this inflammation in this upper part of your body and inflammation of the nerves to the tongue and the nose. And then severe coughing, shortness of breath, where you walk across the room and you're starting to pant, where you have to stop in the middle of your sentence. And then, of course, severe shortness of breath is ultimately the reason people go to the hospital. Fever, and the fever can be high. And also we're seeing a biphasic or a kind of a double whammy to the illness. Many people are sick and then they start to feel better and then suddenly they get worse again 2 or 3 days later. Yeah. The headaches can persist. The low-grade fever can persist for a week or two. That's the general kind of constellation, as I understand it, of the symptoms. The psychological stress is not to be trivialized. It's quite impactful in families, and that's where rather than waiting for those things to happen, you try to be proactive about it. Like I said, getting out in nature, just the color green. You have got green behind you. The color green is very soothing to the spirit. Getting out in nature, if you can, getting out into the woods, marching around, collecting worms and leaves and whatever, twigs, or, doing some busy work with your child. Just to get out, have fresh air is a good thing to do. Physicality is good. So massage or scratching or building something together or exercise is also good, just to expend some of that energy that you have. Like I said, the good listening is extremely important part of this. Setting up schedule routines that are predictable and figuring out some fun things to do. This doesn't have to be all ad hoc. You can have a family meeting every 3 days and say, okay, what do we want to do? What do we want to do next week? And you have a list of different things. What books do you want to get? What movies? What games do you want to play? What things do you want to learn about? What things should we cook? I have a list of 15 things that we might eat next week. What do you want to? And involve your child in that process so that they feel cared about, respected, and you'll feel better as well. Interestingly, when you give a massage, not only does the person receiving the massage feel better, but the person giving the massage feels less stress. So those are some maybe simple off-the-cuff things that you can do. I do want to
Well,
say
thanks.
one more thing, which we're very excited about as a company. And thank you for mentioning in the very beginning about SNOO. So SNOO is a responsive baby bed that my wife and I created and we launched 3 years ago. It's been used by tens and tens of thousands of families now. It's really not a bed. It's really, it's kind of your older sister who moved into your house and said, I'm going to hold, rock, and shush your baby all night long. And if the baby's upset, I'll rock and shush the baby some more. And if I can't calm the baby down, I'll get you for a feeding. And so the bed will rock and shush babies all night, imitating the womb experience, but respond with more sound and motion if the baby gets upset. Several different levels of response. Half of the babies calm within a minute, and half of the babies don't calm within a minute because they're hungry or they need a diaper change or something else is going on. And so what we've seen is that we've been able to add 1 to 2 hours to a baby's sleep, which sounds remarkable, but actually it's exactly what you would expect if you drove your child all night in the car. So
Yeah.
you can drive them all night in the car without driving them all night in the car is the goal. And we've also secure babies on the back. They cannot roll to an unsafe position. So we've now measured 84 million hours of safe sleep in babies. And we're being evaluated by the Food and Drug Administration potentially as the first SIDS prevention bed. We're hoping to be able to prevent 90% of infant sleep death, and we're in have a very good start to that as well. So we're using that. Employers are giving this away as a benefit to their employees. But in terms of COVID, we're now donating beds to hospitals, frontline hospitals, to help support now nurses who are short-staffed, and also to be in the room with mothers who either are isolated because they have the virus or whose family cannot come and be with them. So they have a caregiver in the room with them. So we're in, well over a dozen hospitals. We'll be adding another 20 over the next couple of weeks. We're internationally supporting hospitals as well. So happy to have anyone reach out to us on our website, which is happiestbaby.com, or on our Instagram handle, to let us know if you have any interest in supporting us or if you have a hospital that we can support. And we're very excited to be able to help the frontline nurses and doctors.
Well, thank you. You've always been at the front lines, Harvey. So once again, no surprise. And one of the other great benefits of SNOO is it helps the parents get some rest, right?
Exactly. Yep.
Which
That's
is where,
the goal.
Yeah, where we started with this conversation. Harvey, thanks so much. I can't tell you how much I learned just listening to you. There are many questions we didn't get to. That's because people had so many for you. We'll try and get some answers to folks online if we can, and maybe we'll run them by you before and so forth in writing. But thanks again for joining,
Sure,
Harvey.
happy to help. Thank you so much, Ken, for doing this and for all the great work that EWG does. Appreciate it.
You bet. So love to you and love to Nina.
Stay safe.
All right, buddy. Bye-bye.
Thanks.